Now, this is it's a topical question, and it's just constantly, I call it a sewing circle of information, and there's no evidence. So we're looking for evidence for any relationship between massage and miscarriage, and there's none whatsoever. I've done some detailed investigation into if there were any links with massage during pregnancy, and there's actually nothing that shows that. So we have a set protocol that you can massage from the moment of conception right through to birth. So there's nothing that stops anyone from massaging during pregnancy. Obviously, for a woman seeking massage in pregnancy, she's either going to be seeking a pregnancy specialist. If we're teaching the partner some lovely applications, then that's very safe. So we're showing the partner some easy applications. But for a woman to go and have a treatment with a pregnancy therapist, massage therapist, then it would be really important that they see someone who is very qualified in that area. One of my favourite, I'll share you if that's okay, Shilpa, one of my favourite stories is, obviously I've treated thousands of women during their pregnancy, and one of my favourite stories is when I had a client coming to see me, and I was linked in with, I treat a lot of clients coming from obstetricians and midwives, and this one particular client was coming to see me in my clinic one day. She was only 8 weeks pregnant. Anyway, she was driving to the clinic, and she must have been talking to a friend on the way, and her friend said, "Oh my gosh, you can't go and have a massage and not allowed to have a massage in first trimester." So my client was already a little bit anxious, so she stopped the car, phoned the obstetrician and said, "Oh, look, am I allowed to have a massage in my pregnancy?" And the obstetrician, all she said was, "For goodness sake, start the car, put your foot on the accelerator and just get to that treatment." So, it really just shows that, there is this whole misconception on what is massage in that first trimester and into that early second trimester. Miscarriage it's a very sensitive, subject matter, and any woman experiencing loss is it's extraordinarily sad. And so, but massage in pregnancy, if she's well, baby's well, there's no link at all between miscarriage and any sort of tactile or therapeutic applications. So I feel women should be feeling confident when they're coming in for their treatment, knowing that they're in safe, confident hands when they're having their treatment. Because of that question, we actually underwent our first research, and it was a case series. Because of that question, all constantly being coming up about safety of massage in pregnancy. So we have shown, and it's really probably the first study globally, and then we were looking, so because of the amount of in the cohort of that study, we need to do probably a more robust study, but within that cohort we found that there was no harm to mum or baby, and the benefits for the massage was extraordinary. Like we saw improvement in sleep pattern, we saw reduction of stress, we saw improvement of movement as well, and we also also that sleep pattern and reduction of pain. So, all of those things are so important. We always say, well mum, well baby is really important for during that pregnancy time.